My name is Gonzalo Casals. I'm the Commissioner of Cultural Affairs for the City of New York. I want to thank you all for joining us in this very important panel. And I wanted to say that in addition to support our cultural sector through public funding, it is very important for us to also act as an advocate for the cultural sector and a convener. It is our hope to continue to create spaces like, spaces like this for our colleagues to share resources and to come together so we can tackle the structural issues and problems that are affecting our society today. I'm really inspired by, the response that, many in the cultural sector have had to the pandemic. Almost by intuition, many of you came together in community forming groups to figure out, together in community how to solve these problems. The Culture at 3 Call is one of the many other task forces and committees that have been created. And it's really inspiring to me to see, how the sector can come together and all work together to solve these problems. I'm extremely helpful for, the museum reopening task force, not only for coming together and doing all the work and all the thinking that they put on many, many weeks and figure out, what's the best way to safely reopen our museums, but in particular for the enthusiastic response when we invited them to share, their findings and their works with the rest of the community. So I want to thank you all both for your work and for being here today. I also want to give you a little bit of a sense what's going to happen today. After my hopefully very short introduction, we're going to hear a few things, that are the results of the work that this task force has put together. We're going to, hopefully you're going to get a little bit of an understanding of the thinking behind the guidelines and the best practices that are going to be presented today. We understand that not only this applies to museums, but each of your organizations, regardless of, your mission and what you do, is very unique. And you're going to have to do some thinking on how you adapt, these ideas into your operations. But we hope that, by understanding the criteria behind these best practices, it would help you to work on adapting those. And there's going to be 4 focus areas. One is how do you work and interpret, the guidelines put together by government, the state, and the CDC. Of course, visitor of experience operations, staff return to the office, and vendor relations. After the panel, I'm going to moderate a short Q&A. If you have any questions, please put them on the chat, and we're going to pick questions from the chat so the panelists can answer. And before I turn it to the next presenter, I wanted to once again introduce, the panelists and thank them for doing this work. Renee, Bushelle, Sara, Devine, Regan, Grusy, Susan Marenoff, Janice, Monger, Rachel, Pivnick, and Amy Roth. With that, I pass it to Amy Roth, co-CEO of the Whitney Museum.
Great. Thank you so much, Commissioner Casals. We are so extremely fortunate to have your leadership at this particular time for our sector in museums and cultural organizations in the city. I am Amy Roth. I'm the co-CEO of the Whitney Museum of American Art, and I will say first and foremost, thanks to DCLA for organizing this event. It's wonderful to be able to get together with such a large group of peers and remember exactly who our community is and who all of our stakeholders are when thinking about the enormity of the task at hand for all of us. I will say just a few words about the New York City Museum's Reopening Task Force to kick things off, and then I think you all want to hear from our panelists and be able to ask questions. So just first, what is this task force that Commissioner Casals mentioned? It's a consortium of 25 museums that got together initially in April, actually as a much smaller group, about a dozen to start, to look at how we might think about protocols and procedures for reopening our museums. And this might seem obvious right now, given where we are in New York City in phase 4, but back in April, we knew very little about the virus. We all closed very quickly in mid-March prior to the official stay-at-home orders from the government. And you know, we realized, many of us, how closely our fates were intertwined. We also realized that despite our vast differences in location, in size, in audiences, in offerings, really in every way, that we had common concerns and needs about our staffs, about our visiting publics, and what, you know, from an operational point of view, what it would eventually take to reopen our institutions. So way back in April, we were already thinking about this. Although we had very little visibility. You have to remember, this was before anyone was reopening, not just New York State, but anywhere around the country. There was no timeline, no playbook, of course. At that point, I think it was the Met who announced to the public that it would not reopen earlier than July 1. And at that time in April, that seemed like eons away. So we're, of course, way past that date at this point. So initially, we pulled together a group of primarily chief operating officers, deputy directors, really individuals within our organizations who had been charged with leading coronavirus task force. Primarily, it was in closing our organizations, and eventually, as we were discussing in April, reopening at some point. And we posed to a small group of about a dozen COOs and deputy directors at our very first meeting, a hypothesis and a set of questions in the form of a brief that, first and foremost, we were all prioritizing the health and safety of our staff and our visiting public. That we recognized that we were all very different, that we would all have our own unique circumstances and challenges to address. Certainly, you know, you put the Met in any equation and it dwarfs even the Whitney, and we, I'm sure, feel giant to many on this call today. So we recognize those differences, but we also stated that we did believe we could reopen safely with the right precautions in place. And we posed whether it would make sense to think about common protocols and procedures for how to safely reopen our institutions, whether it would help us identify, in working together, best practice and ultimately allow us to best adhere to government guidance, which we didn't have at the time, but we imagined would be forthcoming at some point. Whether working together would instill more confidence in our staffs, in our visiting publics, in safely reopening, and which components of reopening protocols and procedures would be most helpful to ourselves, because we were all individually running our own museums task forces, but what might be helpful to the sector. So would it be guidelines? Would it be a punch list? A timeline, shared communication. So we went through those ideas. And then lastly, how we could, as a sector, make our work visible, enable stakeholders beyond just those that we mentioned, our staffs and our visiting publics, but stakeholders in our broader communities and elsewhere, even in the government, see what we were working on and you know, be able to understand the rigor and the safety involved in our plans. So with the answers to all these questions that we discussed being yes, we formed a group, and we've been meeting since April. The primary purpose of the group was to develop shared guidelines for reopening safely and component parts that would help our sector. And there are two main parts of our work: visitor operations and HR and staff return to the workplace. These have been the main through lines for our planning work. The group enlarged to include, as I said, 25 museums, not just deputy directors and COOs, but the HR leads, the visitor operations team. So we have a very big group of people who have been meeting weekly to put these guidelines for our sector together. And then, of course, once the state guidance was issued for phase 4, low risk indoor arts and culture, our group worked on interpreting and devising paths forward given the requirements from the government. So now we're at that point of time, how can we help others? So we have guidelines, they're on the DCLA website, they're out there. We recognize they are not going to be one-for-one to every organization participating in this call, but we are very interested in helping others imagine, how to go down this path. What are the questions? We wanted to make sure that as everyone was doing this work, that there was someone saying, you know what, we've asked this question ourselves, we've thought about it, we're trying to take some of the mystery and the guesswork out. We've discussed it, we've looked at alternatives, and here's where we've landed. So with that landing point, I think it's time to hand this over to our panelists, and just want to say thanks again to everyone for such extraordinary collaborative work. Very proud to be a part of it.
So did you want me to go ahead and start, Amy, or?
Why not, Janice?
Okay.
We're used to tag teaming, so first discussion topic.
Okay, great. So hi everyone, I'm Janice Monger. I'm president and CEO of the Staten Island Museum. And I also want to recognize Renee Bushelle, who's Visitor Services Manager of Staten Island Museum. And Renee is the one who really co-chaired the internal task force that we had for Staten Island Museum's reopening. So she is very well versed in the very specifics of our reopening plan, and has been part of Visitor Services discussion group for a long time too. So offers excellent perspective here. But I want to reiterate how grateful to everyone I am. It makes me sort of emotional, honestly, how amazing it is how cultural institutions have come together. So, the Culture at 3 p.m. call had its 100th call yesterday. I've been part of most of those, not absolutely everyone, and was, invited to the museum's reopening task force very graciously, and we were so pleased to be involved because it came right at that moment where we were trying to craft our guidelines. So I think that cultural organizations are utilizing each other's resources and being sounding boards for one another just makes this very daunting set of tasks more manageable. And so I guess that's one thing that I would say to everyone on this call is, if you haven't found your networks, do it at this time, but utilize the resource we've created, but that dialogue helps a lot too. So find your institutions that have similar needs, and that really makes the burden a little lighter if possible. But I'm also here today because I've been part of the Mayor's Sector Advisory Council, and that's a group of 20 plus representatives from across the arts, culture, and hospitality sector. So there were a number of sector advisory councils that were created for different sectors. And so I'm on the arts, culture, and hospitality one. We've been meeting regularly. Commissioner Gonzalo Casals is represented on there, as are other city commissioners and deputy commissioners. So I think I was to speak a little bit about that. The first session was with the mayor directly. He spoke with the group for over an hour, and because we've been participating in these forums. I felt fairly well versed to, be vocal about some of the needs around, at that time, securing PPE, visitor safety, staff safety, a lot of the issues that were being discussed. So the mayor really listened at that time, and then Deputy Mayor Devine has been leading the conversation since, and we continue to meet. So, we know things sort of changed with indoor museums not reopening in phase 4 as planned at this time, but we have been assured that it's a priority with the city to figure out the protocols which will enable us to reopen. And I do feel very confident with the set of guidelines that the Museums Task Force has proactively created, that also follows the New York Forward state guidelines, that we've utilized all the resources available to really come up with a very thorough set of protocols that gives us as much confidence as possible that we can reopen indoor museums safely with social distancing and obviously mask facial coverings in place, and a lot of the other measures that you see outlined there. But I feel like we have turned over every stone available in terms of consulting medical professionals, looking at the state guidelines, utilizing each other's brain trust and staff resources. And hopefully this helps others to be as prepared as possible for when the conditions enable us to reopen. So that's what I would say sort of about the various forums that have come together to figure this out. And I really, truly appreciate the collaboration that's happened, and that we're now sharing this more broadly. And I think that's what I would say at this time. So thank you.
So we're going to move to the next topic, and we're going to ask Sara to talk about health screenings.
Absolutely. Thank you so much. Hi, everyone. My name is Sara Devine. I am the Director of Visitor Experience and Engagement at the Brooklyn Museum. And Renee and I are going to talk a little bit about visitor operations concerns. So there are 4 topics we're going to cover and tag team and talk a little bit about what we're doing at the Brooklyn Museum, what the Staten Island Museum is doing. The first is health screenings for the public. The second is capacity management. The third is updated offerings and visitor experience. And the fourth topic is staff training. And I do quickly want to echo everyone's thanks and Janice's comments about how great it's been to work with others and having this community come together. So a huge thank you to everyone that's participated in this planning, to Commissioner Casals for your support and DCLA support in your team, and Amy and her team kicking off the initial calls. There's no way we could have done this alone, and we don't have to. That's why we're all here. So let me dive in quickly because we do have limited time. So health screenings. We talked a lot about health screenings for visitors. That's what we're talking about specifically in this instance. At the Brooklyn Museum, we've decided not to screen visitors before they enter. It is currently not required by government mandate, so we've opted not to go this route. Temperature checks or other screenings we don't plan on doing at this time. In the conversations that we had participated in with health experts, we understood temperature taking, while important, is also a little bit performative in the sense that not every COVID patient has a high temperature. There are also a multitude of reasons one could have a high temperature. So it's not a cut and dry indication of COVID. There was also for us staff capacity concerns in terms of who would take the temperature, how would we monitor that. We are unable as an institution to afford an outside company. That's something I know some of our colleagues are able to do, which is great and would be ideal. But having, hiring a nurse or hiring an outside company to manage this for us wasn't in the cards. And there are also, we feel, some issues related to visitor privacy. That becomes a little bit tricky. So unless temperature checks or other health screenings become mandatory, we would like to shy away from those. If we have to do it, obviously we'll figure it out. But that is not currently in the cards. We will be requiring face coverings for visitors. Our staff will be wearing them as well. For now, our current thinking is that if a visitor is medically unable to wear a mask, our accommodation will be a single-use face shield or visor that we can provide. This is an ongoing conversation and it could change. Face shields are of course better than no covering, but still are not as good as a mask that would cover your nose and mouth, because of course the air still escapes below the face shield. And so again, with health experts, there's also mixed opinions on this sort of thing. There is of course ADA considerations related to someone who's perhaps medically unable to wear a mask, which is why we would like to work with the face shield as an option. As an institution for now, we're saying if you cannot wear either, we wish you luck, but you'll have to come back another time. We'll maybe give out some free passes for a visit in the future when it's safe to do so. But overall, that staff health and safety and the health and safety of all of our visitors are paramount compared to the need of one particular visitor. It's a hard conversation and decision to make, but that's what we feel most comfortable with. Staff are required to have a health check before they come in the building. That includes a temperature check at home. They'll do this daily before they come in. So the other thing I just want to note about, in particular, the public facing is these measures of masks, in particular, speak to recent surveys that have been done about comfort of visitors returning to the cultural sphere. We'll be sending out as part of, after this, the Culture Track COVID edition study that just came out that does talk, that La Placa Cohen and Slover Linnet put together, that does ask arts and cultural audiences how they're feeling about returning to the spaces. And the things that are making people most comfortable are the things you would expect. A vaccine, which of course we have no control over. Increased cleaning protocols is something that will make people feel more comfortable, which is something we're all talking about doing. Reduced capacity, we're going to talk about that next. And also face masks required for visitors and for staff. Those are the top things that are making people feel comfortable returning to those indoor spaces. And with that, I'm going to hand it to Renee to talk about what Staten Island's doing with health screening.
Okay, Renee, if you can focus a little bit on the staff side of health and checking.
Oh, okay, definitely. Again, this is Renee Bushelle from the Staten Island Museum. Pleasure to be here. And yes, the Staten Island Museum staff will be conducting self-administered health assessments before they leave home. And what we've done is to come up with a checklist. Now, this is something that the staff will refer to on a daily basis. And we wanted to provide some structure around that. So the staff is asked to go through each step, which is, are you feeling any of the symptoms that are associated with COVID, any malaise, difficulty breathing, any coughing, again, all of these symptoms that could precede an actual fever. So any nausea, things like that. And if you answer yes to any of those questions, the default is to stay home. Additionally, you would be contacting your supervisor, the HR department, to let them know what your status is. And of course, if there is any chance that you've been exposed to anyone who has either exhibited symptoms of COVID or has been diagnosed as a positive COVID case, then you yourself have to go through testing as well. And, apart from requiring our staff to conduct these screenings, we're also conducting temperature checks for vendors. But we have chosen to not do visitor screenings for the public in the eventuality of our reopening. Instead, we identified several policy communication points to inform visitors about what to expect when they come to the museum. Starting outwards and working our way in, the website's visit page will provide new operating policies for users, where they'll also be reminded about assessing their own health before setting out for the museum. And then also throughout the ticket, online ticket buying process, which we're going to shift to, website users will see summarized COVID-19 operations policy information, and at the final step of purchasing that ticket, additional messaging will communicate something like, by purchasing your ticket, you agree to comply with the museum's COVID-19 operating policies. And of course, once we get to the point of establishing a date and we're confident that we're going to be able to open, then we will bring in our PR, our marketing department, to push that information out to the public, and then also communicate our operating policy information through press releases, e-blasts, social media, and of course employing our telephone system to communicate that as well. Visitors, once they arrive on site, will encounter external and internal signage, and again, communicating our policies. As far as face coverings go, masks are required of staff and public entry. We haven't concluded whether or not face shields will be a viable alternative for entry, as their efficacy remains in question. But front-facing staff working outside of COVID enclosed spaces during public operating hours will likely use a combination of mask and face shields. Let me also add that we are also providing our staff, as part of their assessment, with thermometers to make that a little easier for them. And all of these processes have been addressed in the training that was recently rolled out.
We're running out already a little late, but I know that both Sara and Renee also wanted to talk about how you manage capacity in the building.
Yes.
You can give us 2 cents on that.
Okay. Sara?
Sure. So we are limiting capacity to about 25%. We're using timed tickets to do this. We were in the habit of doing that already for our special ticketed exhibitions. So we have a platform in place that does that. We use ShowClicks, and we will be rolling that out for general admission in addition to our Studio 54 ticketed exhibition, which thankfully gets to reopen at the same time. We'll use that, the ticket sales, as our capacity management as well. So we've divvied up them across the day to keep an eye on capacity there. And we'll just be monitoring the ticketing sales as a way to keep an eye on capacity, in addition to the clicker count that our security guards also keep.
Okay, for the Staten Island Museum, we too will be operating at a 25% capacity. We are going to adopt an online ticketing process, but I don't think that we're going to need to go to time ticketing because of our volume, our visitor volume, which is modest. However, if we find that we, because of increased demand, that we have to go to a time ticket policy, well, then that's something that I'm sure that we will be able to do that. In addition, we have our manager of exhibits has removed interactives from the galleries. We are selecting shorter films to show in galleries where there would be seating to discourage lingering in a space, and also we're thinking about utilizing existing technology like flat screen televisions to have reminder messages about remaining socially distant for our visitors.
So before we move on to the next subject, you spoke mostly about the experience, the visitor experience in the galleries. What are you planning in terms of public programming, educational activities?
Right. So unfortunately, with with the guidelines, we are going to be able to do very limited offerings on site. So we currently do not have any on-site indoor public programs planned through the rest of the calendar year. Similarly, we are not going to be hosting groups or school groups for the foreseeable future, at least certainly not in the normal capacities. We will not be able to offer coat check or food and beverage services for the foreseeable future as well. We're also removing things like touch screens, iPads, things that were shared devices. So because of the cleaning concerns there and the cleanliness concerns. We also have some, laminated gallery guides, some art, some kind of drawing and feedback areas that unfortunately we're going to have to remove too for the time being. Interestingly, the state guidelines recommend paper takeaways, i.e. like the restaurants have been doing paper menus that you can, toss. We've actually opted to not do any printed materials for now, and to focus, we'll be repurposing the map to digital screen available via QR code and on our website. So people can take a digital copy with them. That being said, we are only opening 2 floors when we first start. So the map will be a little less necessary as normal with less offerings available. So hopefully that will keep people from being too confused.
Okay, so while our building may be close to the public, we are fortunate to be on a campus with ample space just outside of the building to install an outdoor version of our most recent exhibit about women's suffrage and the strategies around gaining the right to vote. We opened that exhibit in early March, and exactly 1 week later, we had to shut down. So that at least we're able to offer the community some of our gallery experience outside of the building. Other than that, the museum will continue to deliver online programming for the foreseeable future. There is a possible exception to that. We're a museum inside walls and outside in the community, so we do conduct monthly bird walks, and which take place outdoors in various public settings. So we're pretty confident that when we do get the go-ahead, that we'll be able to accomplish some social distancing at that type of event. Inside the building, individual audio guides that we were already in the habit of disinfecting after each visitor use will be discontinued.
Great. Just one more question for the two of you. As you put these guidelines together and you're getting ready to reopen, what's the type of training that you are thinking, for your staff, to enforce these, guidelines?
Yeah, thank you for that. Staff training is going to be immensely important. We're actually going to offer it both to our front of house teams and to any staff member that would like to participate, just knowing as we reopen, anyone with a badge walking around the museum gets stopped and asked questions, right? So being prepared for that. We will do some basic training related to the new protocols and procedures, making sure everyone's aware of what they are. We're doing PPE training, best practices on donning it and taking it off. Everyone who's returning to the building is going through that training before they return. I think the special training we're really interested in and in a way looking forward to from a helpful standpoint is de-escalation training. I'm sure you've all seen the stories coming in about the confrontations with mask wearing and enforcing those at certain stores. There's no reason to expect that our visitors would behave any differently than the regular public. So we want to be prepared for people not wanting to put a mask on or being upset about that rule in particular, and very cognizant of racism and anti-racism lenses through which we're looking at this and the challenges they're in. So we plan to be working with a group called Holla Back. You may have heard of them. They do have some great trainings actually available for free online. We hope to engage them to do more specific trainings related to our specific moment to COVID, et cetera. They do overall de-escalation techniques. We want to be mindful of the fact that both visitor and staff anxieties are going to be running high as we reopen and kind of wade into this new world together. And we want to be prepared to put everybody at ease. And I think, you know, hopefully we won't have to use it, but just given the opportunity for staff to participate in it is helping to relieve some of their anxiety coming back to the workspace, and potentially dealing with people who are not adhering to the new protocols. But we'll similarly be doing a lot of communication and heavy communication to the public about what our new protocols will be. And I think it will help overall, because part of that goal, as Amy was saying, is that as institutions, we would be adopting similar guidelines. So anyone going to a cultural institution in New York City can expect a similar experience with this. And that I think helps a lot. But still having the staff prepared is very key for us.
Renee, anything to add?
Yeah, Ashley, and thank you so much, Sara. I think that, you know, for the participants, for the listeners on this of this panel, I think you'll find that there are some alliances that Sara and I are pretty much in alliance with our approach, and then there are going to be these nuances. So at this week, the Staten Island Museum is in its first stage of reopening the office to the staff. But, you know, before getting to the point of actually delivering the COVID ops training, there were regularly scheduled staff meetings, email updates, and surveys, and which, when you think about it, are all important to preparing the staff for an eventual return. So it's almost like we've been in training for several weeks, for months now, before delivering the actual training. We did roll out a self-guided operating training last week, Monday, which was preceded by a discussion to prepare the team for the process, and then a post-training discussion to cover any operating open items. We made no assumptions about the training, about what people knew or didn't know, and started from the basics of what COVID is and the human toll that it's taken locally and globally. We used the resources from the CDC and local authorities and the guidance of the museum's reopening task force and our internal group, and covered the correct use of PPE, hand washing etiquette, cleaning and sanitizing protocols, employer and personal responsibilities. We also discussed changes to the physical workspace and physical distancing and how that changes the dynamic of the workplace. We're all very social beings, and environment. And then we also took a pledge to stay abreast of public health obligations and implementing these aligned operating strategies. And we're encouraging dialogue beyond the training so that communication continues to flow and staff feels heard and supported. Lastly, our HR policies were amended with COVID-19 updates. And we're also working on a quick reference guide for staff, and that's in progress. And the training wraps up with an employee policy compliance statement that would be signed, that they agree to abide by the policies that we've developed. And hopefully all of these steps combined will help to, as you said, Sara, provide some comfort and ease as staff return to the office.
Thank you, Sara and Renee. Before we move into the next topic, I just want to announce that hopefully soon we're going to be providing, as an agency, a similar panel like this on de-escalation and sort of handling, dealing with visitors in COVID-19 era. I want to pass it to Rachel, yes, and Regan, who are going to be talking about employees returning to the workplace.
Hi, everybody. My name is Rachel Pivnick. I'm the Deputy Director and Chief Operating Officer of DIA Art Foundation. We have 4 museums in New York State. DIA Bridgehampton opened last Saturday. Hooray, hooray, hooray. We have 2 small museums, Broken Kilometer and Earth Room in New York City. And our largest museum is DIA Beacon, 240,000 square feet up in Beacon. We have our friends and family preview starting this Friday, and we open to the public on August 7th. So what a heavy lift we've been through. Regan had started talking about health screenings. I'm going to talk a little bit more about the logistics of health screenings and a little contact tracing. and then pass it over to Regan to talk about managing anxieties of the staff coming back, because the emotional return is just as important as the physical return. And then the cause of many anxieties, we'll talk a little bit about commuting as we go through. So all of you know that New York State requires that we have mandatory daily screenings for staff, contractors, and vendors, which is a very nice thing to say, but much more difficult to actually put into place. We had looked at various apps, but didn't find any at that time. We were looking in May. Many of them have gotten much better since then. And decided to use our own, to create our own Wu-Fu questionnaire. You could also use SurveyMonkey, where we ask the names of everyone's name, email address, what location they're going to, and then the 3 questions that are in the guidelines. Over the last 14 days, has anyone tested positive for COVID? Have you been close to anyone who has tested positive or had symptoms? Or have you experienced any symptoms? We recently added a 4th question to inquire if you spent 24 hours or more in a high-risk state, because that seems to be the question most people answer yes to, thank goodness, and they just have to quarantine. It's very simple because it is an online questionnaire. So staff who are responsible for contractors just forward the link over to them and they answer it before they come in. They get a reply on their phone, which then they show to someone at the gate. Now employees will go in through one gate in order for us to confirm that, that each employee has been cleared to come in for work. There are paper versions for those who don't have online access. So it's important that someone takes the survey before they get into the workplace and that it's easily accessible. All of the email responses go to HR because we want to keep this confidential. And the way that we set it up, we set it up where all the questions, if you're cleared to work, answer no, and they go into one inbox at HR. But if one of the answers is yes, it gets flagged, and HR would then contact the employee and go through another series of questions to determine when they can come back to work. And this is really the trickiest for us when we were trying to figure out what the policies would be. New York State has a lovely document with a really wonderful title called New York State Interim Guidance for Returning to Work Following Infection or Quarantine. And this will be very helpful to you. We had to remind everyone that, we're not here, we're not medical professionals. We don't want to make a medical decision. We want to make sure that the procedures are in place so that there's no question everyone is handled in exactly the same way. And we're really, really standardized and go through. So this document will be very, very helpful in following up to see when someone can come back into the workplace. Of course, there are people who can work from home, and if they're quarantined or they're feeling all right, they can certainly work from home, but that's still, many positions cannot and need to go in the workplace. Renee mentioned the 2 new policies which all of your organizations need to add to your employer handbook. And this follows I'm sorry, I wrote down all of these names because they're so catchy that I can't remember them. The Families First Corona Response Act, where there's now an expanded paid sick leave act and an expanded family medical leave act. So those 2 would be added to your employee handbook and communicated out to employees so they feel comfortable in calling out sick, and they feel comfortable that if there's an instance where they need to stay home because they are ill or because they need to care for a child or another relative, then they're able to take advantage of that. I'd like you to remember that all the procedures need to be consistent and easily understood, and they need to be simple going through. What we're doing for contact tracing is using the email responses from the people, a lot of people at DIA work off-site, using the email responses to understand who's on site that day. And then we would, if there is an instance where we need to find contact tracing, we'll just use those email addresses to understand who was on site that day to try to make contact tracing easier. Also, you know, as part of our training, you have to communicate to your staff that we are required to report when we know that an employee has been infected. We're required to report that to the state and local Department of Health, and then try to keep the employee's name as confidential as we can as we're going through and learning about and follow whatever contact tracing proceedings we need to follow. I'll turn it over now to Regan.
Thanks, Rachel. Hi, everybody. Glad to be here today. My name is Regan Grusy. I'm the Vice President for Strategic Partnerships at the new museum. And I'm going to talk a little bit about managing anxieties. I'm sure we've all been on a million Zoom calls during which the phrases, I'm stressed, I'm scared, I'm nervous to go back to work, come up again and again. And the reality is that this is a really stressful time, and it's one of the most challenging years that many of our organizations have faced. So as we continue to develop our staffed return to work plans, one of the guiding principles of our planning is not only to make sure we are operationally ready, but to ensure we're considering the staff's emotional return to work as well. It is as important as their physical return, as Rachel has mentioned. So given the precarity of and the uncertainty around so many external factors, such as schools reopening, childcare, travel restrictions, mental health, isolation, et cetera, we're really endeavoring to bring as much stability in order to better manage that anxiety in two ways. One, by creating as many open channels for conversation and feedback with our staff as possible. And two, through preparedness and readiness. We all know that anxiety can certainly blossom in the absence of certainty. So we may not be able to control coronavirus itself, but we certainly can control how we respond to and prepare for it. So number one, the communication piece. I'm sure many of you are already instituting weekly, have instituted weekly, sometimes bi-weekly check-ins. Certainly they've become the norm. In addition, many museums, including us, have instituted all staff meetings and town halls, as well as regular all staff communications from leadership. But beyond just communicating with staff or at staff, it is really essential, perhaps even more so now, to hear feedback from the staff. So we're doing this in a few different ways. First, we've launched our first online all staff survey. We've assessed things like working from home, the effectiveness of that. We've also asked staff what would make them most comfortable in returning back to work. By the way, our number one response was distance between workstations. We are using a survey format via SurveyMonkey, but there are also many simple forms that can be set up in Google Docs that are also very easy to use. And all of the feedback that we receive from these surveys are informing our plans for reopening and staff return. We've also launched a portal, also via SurveyMonkey, which allows staff to submit anonymous questions. I think this is super important to make sure you're getting the most honest response from staff. We are finding that many of our staff are utilizing this tool. It's really key. We've also instituted regular departmental meetings to ensure departments hear from leadership and members of our internal reopening task force, and to help kind of group think through challenges and issues within sort of a familiar and empathetic team format. We're also planning to do continued pulse check surveys with the staff in the weeks ahead. One of the other ways in which we are mitigating staff anxiety is by organizing discussions with health experts. We all work in cultural organizations and we know this field so well, but as many of my co-panelists have said, we are not experts in public health and infectious disease. And so we really want our staff to hear from the experts. We've engaged an infectious disease expert from Mount Sinai for an all staff Q&A, which have really helped dispel some myths and anxieties. We've found that there is in particular high anxiety around being around asymptomatic people and what does that mean, hygiene around workstations or barriers around workstations, and of course, the public transit piece. Finally, some organizations have employed an employee assistance plan or other mechanism by which staff can seek assistance for personal and workplace stress. This can be coordinated through HR departments and can provide services that can help staff through stress management programs, mental health seminars, and that kind of thing. So we haven't yet explored that, but I know some of my colleagues on this call have. Moving on to the commute, and Rachel, please step in here if you wish as well. The transit is especially concerning for all of our staff. I'm sure many of you saw the piece in the Times last week that stated that even if, as New York has slowly started to reopen, that daily subway ridership has actually plateaued at around 20% of its usual passengers. So we're already anticipating that ridership is going to be, you know, a fraction of what it was when at the beginning of the year. The commute was our #1 factor cited in staff concern in returning to work in our staff survey. We are planning to manage this through staggered work shifts and off-hours commute. We're also making room for bike storage at the museum for any staff who wish to commute via bike. And, you know, in addition, educating staff on how to prepare best for a public commute. It may seem very simple, but many of us have gotten on the subway without a second thought to kind of what it might mean to get on the subway. You got your Metro card, and that's it. But we have been we've been trying to make it very clear how important it is just to kind of think through what it means to get on the subway now. So take an extra mask, make sure you have your hand sanitizer available. You know, leave plenty of time before you get on the subway in case you need to let certain cars pass. So it may seem simple, but I think it can help mitigate some of the anxiety around getting on public transit. Rachel, do you have anything else to add? Oh, sorry.
No, please.
No, I think it's all good.
Great, thank you, Rachel and Regan. Now we're moving on to Susan and talking about vendor relations.
Thank you, Commissioner. I'm Susan Marenoff-Zausner. I'm the president of the Intrepid Museum, and it's been a privilege to be a part of this. And I know that everybody has been working so hard to be able to get this done and advocate for our culturals. And so, you know, we have all gone to, and we're all going to be going through great lengths for our reopening. And so we are also requiring our vendors to do the same. And so when you think about vendors, for us, there are two categories. There are the partners that are with you all the time, whether that be food and beverage, whether that be your retail, anybody else that you might have as part of your institution and maybe is transparent to your visitor that they are a separate organization. And then there are your one-offs, those that'll come on to do repairs or exhibition fabrication, for instance, or anything else that might be every so often, your special event folks who will have deliveries made and things like that. So what we have done with all of our vendors in both categories, if we have submitted to them, and those that we know and those we've had in the past, we've submitted to them what our plans are and what our requirements are for them. But we've also asked them to submit to us what they are doing within their own organization. So our caterer, for instance, our daily caterer, our special event, private event caterer, our retail store, and so on. And then we'll be hosting a symposium before we open with those vendors, with those partners, so that we can all share information and really be clear about what we're expecting, not only from the pre-visit, but when they visit. We'll have everybody checking in at our gate, our front gate. For those that are our partners, they will be using, I think Renee and Rachel have both referenced the app. They will also have access to this app, so they will be able to show our security guards a green or a red screen. If they have the red screen, they cannot come in. If they have the green screen, they can enter. And then anybody that is calling them in or anybody that they are working for, whichever discipline it is, will also walk them around the site to make sure that they maintain social distancing, that they're wearing their mask, and they're doing everything that we require them to do. We're going to open, regardless of all of this, with just our core business. We want to make sure that we get our core business correct. And that's obviously on a smaller scale too, because we'll be closing off some of the very tight spaces where we can't even do perhaps a one-way route or one-way travel. So we're going to open with our core business for a couple of weeks, make sure that we have that down pat, and then we'll slowly be bringing on the vendors and the partners that we're able to according to the guidelines. For instance, if indoor dining remains closed, we'll wait until, of course, that is reopened. And so as far as sourcing and procuring, we also have created for this group a document that can be shared out that will talk to and speak to all of the PPE that we have procured and the various things that we've done with our filtration systems, ionic filtration, our air conditioning, all of those questions that you might have. We've actually provided that information with item numbers for convenience purposes. So that's the quick rundown for that.
Thank you, Sara. So we're going to open now for a Q&A with the participants. Feel free to add your questions, as some of you have done. Before we jump into the questions, I wanted to make sure, want to clarify something. The Museum Reopening Task Force is a self-created group. All these folks decided to get together and do all this work. This is not an official group created by DCLA. When we met with them and we saw all the work that they have put together, as you can see, we thought it was important to share all this information to the rest of the sector, and acknowledging that not everybody has the time and the resources to devote to rethinking pretty much your business model. So I just want to make sure we recognize that, and we recognize again, you know, this group for sharing all this information with us. I'm going to tackle the short, simple questions really quickly. Rachel, you mentioned the two guidelines, you know, in terms of HR that you added to your employee manual. Can you just tell us the name of those two guidelines again? It was related, you're muted. It was related to family leave. And
it's through the Families First Coronavirus Act. One is the Expanded Paid Sick Leave Act, and the other is the Expanded Family Medical Leave Act.
Thank you, Rachel. Another quick question, or not that quick, you know, there are questions about specifically about smaller spaces in the museums that pertain not to the galleries, but bathrooms and other areas. Anybody that wants to talk a little bit about that?
We figured at DL, we figured out how many people, what the capacity should be in each of the restrooms, and put up stanchions in front of the restrooms for the visitors to self-regulate how many people are in the restrooms at one time. And we also put down, we use circles. We put down circles on the floor to indicate where the queue would be going through.
Thank you. There's also a question about what's behind the criteria of doing health screenings for staffers, but not necessarily for visitors. I think Sara mentioned a little bit of that, but if you want to clarify again.
Sure. Yeah, that's a great question, and a lot of thought has gone into it. I mean, the decision for us, or the difference with staff screenings versus visitor screenings, is for staff, yes, we're asking for temperature, but we're also having them fill out a form with other things that relate to symptoms. So it's the combination of that information that's informative. Whereas with visitors, it would just be a walk up in one of those temp guns or an infrared camera or some other way, and that would be the only thing that would be helping you make that decision. And so that's kind of part of the reason why. And then with staff, similarly to what Rachel was describing, we have a form, I think we used Google, that staff have to fill out, and HR gets it. And again, that allows us to maintain confidentiality as well. So only if a red flag question happens do they have a follow-up conversation. So it's more in depth, it's more nuanced.
And if I can add to that as well, I think we are also all messaging quite a bit. We'll be messaging on social, on our website, everywhere we have an opportunity for visitors to say, please do not come if you have a fever. Please do not come if you have any of these symptoms. So while we won't be doing it on site for our own staff, if they do have a fever, please don't come in. If you have any of the other symptoms, please don't come in. But the same applies. They may have no symptoms and come in and have COVID too. And so we're treating the entire organization, both staff and visitors, as though, and this sounds strange, but as though everyone has COVID, meaning we're enforcing the social distancing. We're enforcing the cubicles being separated by both the higher separators and the further distance. We're enforcing the fact that we have to clean as often as we're cleaning in all of these different areas. So all of those enforcements are to say, we don't know because you can be asymptomatic. So we're treating the entire organization as though you do have it and you're asymptomatic.
There are a few, thank you, Sara. There are a few questions that pertain to accessibility, and we understand that we need to step back in a lot of, services like, probably audio tours, audiovisual devices, how are you thinking, in terms of assisted listening devices, and, somebody also asking the opportunity to provide visitors with wheelchairs?
Yeah, I think, so at Brooklyn Museum, we will provide wheelchairs still. We're debating about whether or not we'd like to offer that as something someone could book ahead of time or not, but we'll make it available regardless with a cleaning protocol afterwards, and probably would need to take the chair out of rotation for 24 hours after cleaning. I think we can actually look to clothing stores right now to see how they're dealing with these things, because they are actually allowing try-ons in certain scenarios now, and it does include pulling clothes off the floor for a while after they're cleaned. So starting to look at those protocols. ALDs for us are actually not going to be needed because in our sense, they work in our auditorium and we're not doing any public programs. We don't actually have audio tour, so that's not an issue. So any need for ALDs is actually non-existent. All of our videos that are playing in the galleries are captioned. So we will be, so you'll be able to hear them that way. We've removed, some of them had like shared headphones and things, those are all getting pulled. But everything is captioned so that you can still access any spoken word with the videos that are being played in gallery. So we won't offer ALDs, but we also won't have a need for them, if that makes sense.
There's a question that I think I need to answer, which is when museums are planning to reopen to the public. I just want to remind everybody that although we're extremely enthusiastic about reopen museums, we still cannot, based on state guidelines. I myself and my team were working really hard to at least accomplish two things: either get very soon a date in which museums can reopen, and if that's not the case, understand when that decision is going to be made, and where the benchmarks in terms of the metrics around the pandemic that we're going to keep in mind as making that decision. So hopefully very soon I can come to you with good news. And then again, the other thing I want to say is that, I don't want anybody to confuse our enthusiasm for museums to reopen by thinking that you're forced to reopen. We want everybody to be able to reopen at their own pace and to do so when, your staff and your visitors are safe. Any knowledge, any words of wisdom in terms of HVAC and changes that you have implemented or you think need to be implemented?
I can answer that. We checked all of their 25 air handlers at Dia Beacon. We've checked all of the dampers to make sure that they were working. Some had not, and then we've increased the amount of fresh air that comes in through each of the dampers. We have filters that are at least MERV 13. Governor Cuomo allows for MERV 11, but MERV 13 is even better. Most of our filters are MERV 14. We disinfected the coils of all of our units, and we're changing the filters more regularly.
Great. Another question that I think, we touch on this, but it's worth, answer directly. Are you testing your staff? And I'm assuming the answer is no, but like you want to explain why you're not testing your staff and why you're doing this self-assessment before coming to work. Anyone?
We're not requiring a COVID test to return to work unless there were symptoms reported that can help you return to work faster if you get a negative test. Obviously, if you get a positive test, you'll have to get cleared for work again, but it's not in the ongoing suite of requirements as of now anyway. Because of course, there's also considerations of coverage and getting one and health insurance and finding a place that has it for free, et cetera. And then how often do you have people take it? So for now, it's only tied to symptom relations. Or we similarly are restricting personal, well, one, we have no business travel, of course, but personal travel to any of the states that are on the no-no list right now. So you have to go through HR and your manager to get approval to travel to those states, because obviously there might be a need, but then you'll have to quarantine. I think if you get a negative COVID test upon return, then there's some hope there too that you could return faster. That's the current thinking anyway. Could change. So
another interesting question is, many of you have community partners. You have free days. You extend, free tickets to different communities. How do you envision doing that with now a time-ticketed system?
Well, at the Staten Island Museum, yes, we do have community partners that we try to extend ourselves towards. And honestly, this is something that we have that is in discussion right now. So we don't necessarily have an answer to that, but we definitely want to remain open and available to them as much as we possibly can.
And so we too will have timed ticketing as well, but we will also be able to have walk-ups that will come in, and if there is room in the slots, then we will include them in the slots. But again, we will be pushing out information. As a matter of fact, our opening, and I think many of us are opening with community partners first to come in for the first couple of days, first week, first month, whatever it might be. And so we will be pushing out that information that we're open, that it is timed ticketing, that we may ask to wait, in social distance spaces. Again, because we're only at 15 to 25% capacity when we open up, we're hoping that the message gets out there so there won't be necessarily an influx. And for those who can do timed ticketing online, we'll be able to utilize that as the beginning of the capacity count.
Great. When thinking about returning to the workplace, are you thinking of only essential workers or the full staff?
At the Staten Island Museum, we are essential workers. We're on site even at the time of shutdown. And then we opened that up. We opened, through baby steps, allowing curatorial and exhibit management staff to come back as needed because they need to physically touch collection items. And then we had a period of time where we started to create and implement these processes. And now we are just getting to the point of bringing the first stage staffing level back. The next level will be our front office, front-facing staff, and that is whenever we can establish a date to return, to reopen, then we can work back from there, and then we'll know when we will be able to bring them back on.
Thank you.
Just to add to that, I think, this is one of those places where every institution is different also, right? So over 80% of our small staff have a personal vehicle to get to work. So the sort of number one consideration about commuting is largely not a concern for the staff at Staten Island Museum. So that makes it easier for us to offer a safe way back to work and accommodation for those who are not able to do that. We're still operating mostly remotely. We're starting out with just a half day a week just to allow some access to be able to do your jobs more thoroughly, those pieces that you can't quite do remotely, and to just begin to navigate, being in the space with other people, and to test out our own practices in some ways. So that offers you some flexibility to do that. So I think it's another point on which, it varies for every institution. We don't have as much concern about the transit, so it enabled us to sort of open offices slowly and safely in a way that others might not be able to.
Given that we as government are not giving you a clear timeline for reopening, the question here is that how do you rethink or redevelop an opening timeline and just keep it, fluid?
It definitely hasn't been an easy process. And I think that with all of the guidelines that we've established here, we've come very, very far. But what we're waiting on right now is what is the opportunity for us to open? When do we get the green light? We know, and we've worked out that through training on-site, training virtually, we'll need 2 weeks to ramp up the on-site portion of our program, for instance, to actually open the doors. And so we'll set it, once we know it's a go, we'll set a date, but back into that with those 2 weeks, and that'll give us when we would reopen. And what that date is, again, we're all different. So there's no magic number to it. We want to make sure that we're ready, that we're truly ready, and then we'll start that on-site training.
Are there any special accommodations that you'll do for, those staffers that either immunocompromised or they're living with somebody that is immunocompromised? Here the specific question is, you provide transportation, you just allow them to stay home. What's the thinking behind that?
Yeah, I think, childcare is going to be a number one consideration for a lot of people, myself included. And I think that there is, there's certain accommodation for a number of reasons. So, again, we sort of invited staff back to work, but are still looking at people's individualized situations. And if accommodation needs to be made for 100% remote work, that's still what's happening. So I think that's how we're handling
it. Same with Janice, accommodation and flexibility, key headlines for us, just thinking about accommodation and flexibility, given so much uncertainty.
And just one more thing to expound on that, and when we all talked about surveys, we're working on we want to be as transparent and as open as we possibly can, but we also understand, and I don't remember, forgive me, who had mentioned it, but that if it's an anonymous answer, it's anonymous, and that's fine. It informs us. But if there is a unique situation, we ask, please speak up so that we can work with you one-on-one. We don't want to mess with your health. And so that's been very important for us to stress that we really want to work to make sure that everyone feels comfortable in doing what they need to do.
Thank you for that. There's a few questions about resources, specifically those that pertain to training staff. Any names of any consultants or companies that have helped you with training around these issues? You're doing this internally?
So for some of the, I'll jump in, it's Amy, for COVID specific training, there are online trainings. Clear Law Institute is one example. I believe their pricing is something like $20 a person, doing a head count of staff for the entire year. And they follow all of the regulations and requirements per state. That would be then specific to New York State, as well as OSHA and CDC, and it's online. So that's a very, I think, good option for particularly smaller organizations that not only covers the requirement of New York State in terms of COVID PPE training, but goes beyond that as well, and really, touches on a lot of the health and safety measures that are expected of us, and really contribute to the healthiest and safe environment for our staffs. I know Sara Devine mentioned some de-escalation training and harassment training and hollaback, I think, Sara, you mentioned, but maybe you can jump in as well.
Yeah, I think the outside party, they're holla back. So I think their website is like the letter I, hollaback.com. They're local, they're actually from Brooklyn. And they have some available for free online, some short versions. So I do recommend just checking out what they offer to see if it's the right style for you, because they do have some free resources available. We wanted to go deeper than that. They have kind of a two-tier pricing. One is kind of a just out of the box, here's de-escalation. And then they have, for slightly more money, they'll work with you more directly and sit down and have a conversation with your team and come up with more specific scenarios for your needs, which is what we've opted to do. So we will be incorporating that along with mostly other virtual trainings related to our new policies and procedures that our staff will do. And then we hope to do 1 or maybe 2 socially distanced sessions on site as well. If nothing else, just to actually, our front of house teams are not so large that we can't come together and socially distance. And I do think, kind of back to those staff anxieties, but also people just missing each other, having a chance to come back together as a team will end up being very important. But I do note Regan's good comment about just managing expectations of what it's going to be like. Because I've been back to the building and I see people, I'm like, hey, I have to say hi from 6 feet away. How's it going over there? And you really want to go up and give everybody high fives and hug them because you haven't seen that. And of course you can't do any of that. But yeah, so holla back. I recommend checking them out. We've been really pleased so far.
Thank you. And you all been very gracious on sharing resources that we're going to be able to put on the DCLA website. Can you just tell us a little bit what those resources are so the participants are aware?
So one of the things I had mentioned before was the PowerPoint that we've actually submitted. And so that can go up on the website for sure, of where we have sourced all of our various PPE from, the ionic filtration systems, and some of those additional types of elements. We are actually, just as far as policy and protocol too, for our front-facing staff, we're asking that they do wear masks that are in uniform. And of course, as far as policies and protocols, we're asking that anyone who's in offices and is wearing masks is following our policy for nothing that's inappropriate and all of those sorts of things. But all of that information and cleaning supplies, antibacterial, all of that stuff is on this PowerPoint. And like I said, we've even tried to provide as many item numbers specifically as possible to save everyone some time.
Thank you for that. Somebody's asking about, as you ask some staffers to continue to work from home, are there any accommodations that you're providing in terms of resources and technology?
Yeah, we are in conversations about that right now. We also just completed, have sent out, I believe 2 weeks ago, a staff survey to get everyone's read on either returning to the building if that's what their job requires, or continuing to work from home, and what their needs are related to that. And so we're in conversation about what we as an institution can do to help support folks who do need to continue to work from home. Our general outlook on that is we want as many people to stay at home for the foreseeable future, because the more people in the building, just the more people are in the building in terms of potential, contact, unnecessary contact and unnecessary commuting. And having talked to our front of house teams and our essential teams that have been there the whole time, they likewise are like, yeah, no, we don't want more people here either. So, you know, let's keep as few staff on site as possible to keep everything running. So we're in conversation about whether or not we would do some kind of stipend, or if people can, you know, put in requests to pay for certain things or get reimbursed for things related to work, you know, toner or ink or an office chair or, you know, et cetera. But of course, the biggest thing that keeps coming up are things like internet access, or we're all now using our personal phones because we don't have office phones, or I'm using a personal laptop, I don't have a work computer. Those questions are coming up. We're trying to figure out what the most equitable way is to deal with that. But I think we do want to do something. The question is what? We're not sure yet.
And in a moment that, you know, financially it might be difficult to do so, right? Yeah. I'm looking for more questions. There's a question about, you know, how do you enforce, you know, the policy of returning to work, even if somebody is not comfortable in doing so. I think we touched upon a little bit of that. And I think none of us are doctors or legal counsels, but if anybody wants to touch on that.
I mean, I think accommodation is being provided liberally, I would say, is one of the factors. But I think, you know, as you heard Renee speak, doing a really thorough job on training, or, you know, the idea of access to a medical professional to help, you know, with the real concern of information is a big one. I would just say too, I know there's a lot of comments and questions about ventilation and historic buildings and such. So like at Staten Island Museum, our main museum building, we have the MERV 13 filters. We're all good in terms of visitors and some staff, but we're also located at Snug Harbor Cultural Center. That's a historic, you know, landmark site and have historic buildings. So, you know, the way we're dealing with that right now is, I mean, we have a small staff, so we don't have as many variables to figure out, but we're basically just not having staff work in the same space on the same day. So, you know, certain people have their own office spaces. Any shared office space, we've reduced from 3 to 2, first of all, and then they're just gonna alternate days. I think the ventilation questions are still, you know, really trying to be understood. So, but, you know, our understanding directly from epidemiologists is the primary concern is wear your face coverings. So if there is concern about ventilation, one of the choices you have is to just continuously wear your face covering. That I think is the primary means of preventing spread in terms of the actual droplets and such like that. But I think, you know, we need to continue to monitor the ventilation questions because I don't think that's entirely figured out. So our answer to it right now is just nobody's working in the same space on the same day. And, you know, so when we're saying we're returning to work, it's only for short periods of time right now. We're only doing half days to try to avoid meal periods even, things like that. So it's a very slow process. There's no way we're going to be, you know, 5 days a week back to the office in the near future.
Thank you, Janice. I always say that, you know, I like to hope for the best and plan for the worst. What are the plans if, you know, one of your staffers, you know, show symptoms, get sick, and similarly, if you learn that, you know, which probably would be not possible, but if you learn one of your visitors was sick when they were visiting the museum?
I'm happy to.
Go ahead, Amy.
Sorry, go on.
No, we've actually designated, so our security team will be called. We'll ask that either the employee, the staff member, or the visitor just remain where they are. We would just ask other people very kindly, you know, kind of keep them social distance, but then we'd have either human resources or security bring them to what is a designated room. And we'll have both the contact tracing dialogue, but also assess the symptoms. Just again, we're not the medical professionals, just go through the basics, and then call on the appropriate folks that we have to call on, whether it's Department of Health and such, and then be able to inform those who were in the contact tracing realm that they should also probably quarantine, or at least find out what kind of symptoms they have, and we would follow it from there as far as getting the person tested and so on and so forth. If the person's tested positive, we would remain with the other folks who were in that immediate area for more than 15 minutes, because it is about a 15-minute to 20-minute time period of constant contact, and have them quarantine and follow and track what their health assessment is. We do the best we could as far as the visitor is concerned as well. And so I can, Amy, if you want to take it from there. I don't know if you have additional.
Yeah, the only other thing, because I was, and we're totally aligned in terms of, you know, exposed areas, those would be closed off immediately, not touched for 24 hours, and then thorough cleaning and sanitizing would take place. And that's, again, both for staff and for visitors.
Amy, we lost you for a minute. What did you say, the last sentence?
Oh, sorry about that. So the areas of exposure would be closed off immediately. They wouldn't be touched for 24 hours. And again, this would be for staff or visitors. And the deep cleaning routine and sanitizing would take place after 24 hours time.
Remind me, you know, there's a lot of questions about what deep cleaning and sanitizing means. Is that's on the PowerPoint, right? So we can refer participants, you know, to the PowerPoint, right? Great. There's an interesting question. Are you rehanging your exhibitions to allow, you know, social distancing? And I want to add to that is also, are you hanging new exhibitions, or you're just extending, you know, what has been on view since March?
Hi, at the Staten. This is Renee from the Staten Island Museum. Our manager of exhibits has repositioned some things in the galleries, but as far as rehanging actual exhibits, I don't know of any plans to do that. And I'm sorry, what was the second part of the question, Commissioner?
Are you extending your current show? So
yes, the answer would be yes.
Great. More questions about cleaning.
I do know on the cleaning, there's consideration of collections. I think that's kind of come up. So at Staten Island Museum, because we have the proper ventilation and such, we're only cleaning by hand. We are not utilizing any room bombers or whatever you call it, like any airborne mass disinfecting because of collections.
Unfortunately, our time together is coming to an end. I want to thank, you know, the whole task force for all the work that you have done. It is my understanding that, you know, while your meetings are sort of like slowing down, you continue to be in touch to monitor how these guidelines are going to work or not work once you're able to reopen, and you're going to continue to adjust. So maybe I want to commit you in front of everyone that sometime in the fall we can do a gathering again, just to look back and see what worked and what didn't work. I'll do it in front of everyone, so you cannot say no. Not that you will. I want to thank, you know, our panelists in particular, because they have been putting extra work in making this happen, and in particular also Alex from the Whitney Museum and Dion from my staff, who are the sort of the brains behind, you know, all the technology that made us help us come together today. Like I said, we're going to continue as an agency to bring resources to all of you to help you figure out, you know, what's the best way to reopen and to operate in this new normal. And I look forward to seeing you in your museums and cultural organizations face-to-face, hopefully very soon. Thank you, everyone.